All right, we're putting you in the hot seat today. We're going to simulate a full-on consultant surgical oral exam of Viva. We'll take a classic liver surgery case and break down exactly how to think, what to say, and how to absolutely nail the answer. Okay, let's go. The examiner drops this case on you and the clock starts immediately. No warm-up. You're live. What you say in these first few moments is crucial. It's going to set the tone for the entire exam. Your job is to show them, right from the get-go, that you are a safe, systematic thinker. So how do you ace this? Well, you need a game plan, a solid structure. Think of this as our roadmap. First, we'll get into the right mindset for the Viva itself. Then, we'll walk through the patient approach, build a rock-solid management plan, talk about the complications you have to anticipate, and finally, handle that curveball the examiner is definitely going to throw at you. Let's do this. Now, here's something you have to remember. The Viva is not just about spitting out facts from a textbook. Not at all. It's a performance. They're testing how you think on your feet under pressure. They're looking for one thing above all else. Are you a safe and logical surgeon? Every single word out of your mouth needs to prove that you are. Okay, so let's start building our case brick by brick. We can't just jump to the exciting stuff like scans and scalpels. Nope. We have to start by gathering the evidence. A really focused, thorough history is where you start racking up points immediately, and more importantly, where you start figuring out what's really going on. Think of this checklist as your safety net. You'd literally say, I would begin by taking a detailed history, and then you just calmly walk them through these points. Now, for this patient, check out those risk factors. Asking about travel or contact with animals, that is a super high-yield question. It's like a big flashing sign pointing you towards a possible haydated cyst, which, is a classic exam favorite for a reason. And that quote really nails the next part, doesn't it? You've done the detective work, you've got a strong lead. Let's say we're running with the haydated cyst diagnosis. Now comes the real test. What are you actually going to do about it? This is where you have to turn all that book knowledge into a real, practical, and safe plan. Right. This is the main event. This is the core of your Viva answer. You've identified the problem, but now, how are you going to solve it? You need to lay out a crystal clear plan that covers everything from getting the patient ready for surgery all the way through to the principles that guide your hands in the operating room. So, let's say the scans confirm it's a peripheral haydated cyst. The definitive move here is surgery, and you'd confidently state, my proposed operation is a pericystectomy. But here's the key. You can't just say the name. You have to explain the why. The whole game is about getting that cyst out clean as one block without spilling a drop. Mentioning that you're trying to prevent anaphylaxis or seeding the abdomen with more cysts, that shows you understand the beast you're dealing with. You want to really level up your answer? This is how you do it. You don't wait for the examiner to ask. You tell them when you would, and just as importantly, when you wouldn't do this surgery. Explicitly stating, look, this is perfect for a peripheral cyst, but it's an absolute no-go if it's deep inside the liver or tangled up with the main bile ducts. That sentence right there is like a giant check mark in the this candidate is safe box. Now you got to talk them through the operation itself. You don't need to recite a textbook, just hit the critical safety points. Mentioning that you're packing the area with hypertonic saline, that shows you're worried about spillage. Mentioning you have a Pringle maneuver ready, that shows you're anticipating major bleeding and have a plan for it. When you clearly explain these steps, you're not just describing a procedure, you're proving you're a safe operator. Okay, you've just masterfully described the operation. A decent candidate might stop right there and wait for the next question, but you're not going to do that. A great candidate is already thinking about tomorrow and the day after. They anticipate the question, so what are you worried about now that the patient's in recovery? That kind of foresight, that's consultant-level thinking. And the first big red flag that should be on your mind is a bile leak. It's one of the most serious things that can go wrong after liver surgery. You need to be the one to bring this up. It shows you're not just thinking about the 4 hours in the OR, but about the patient's entire journey. So here's how you structure that answer. First, define the problem. Second, explain how you'd investigate it. And third, lay out your management plan. But here's the detail that scores the big points. Giving a specific threshold, saying if the drain output is over 100 milliliters a day of bile, my next step is to consider an endoscopic biliary stent. That's a precise, confident, and evidence-based answer. The examiner will love that. All right, what's the other big monster we need to worry about? The liver itself just giving up. Post-op liver dysfunction. It's so important to talk about this because it proves you see the bigger picture. It's not enough to just get the cyst out. You have to leave the patient with a liver that actually works. When you talk about this, you can break down the risks, patient factors, liver factors, surgeon factors. But what really elevates your answer from good to great is focusing on prevention. When you start talking about advanced strategies like preoperative portal vein embolization to make the future liver bigger before you even operate, well, you're showing them you're already thinking like a consultant, planning your moves weeks in advance. So, you're feeling pretty good. You've handled the case, the surgery, the potential complications. You think you're on the home stretch. And then, the examiner leans forward. They're about to throw you a curveball. This moment, right here, is where the highest marks are either won or lost. And there it is, the twist. The pathology report is back, and your benign cyst is actually cancer. The absolute worst thing you can do right now is panic. The examiner isn't really testing your oncology knowledge here. They're testing your pulse. They want to see if you can handle shocking news with a calm, safe, and systematic approach. Your response needs to be like a protocol. Step 1, take a breath and acknowledge the gravity of the situation. Step 2, immediately state the next logical step. We need to perform full staging investigations to see if this is spread. And step 3, this is the golden answer. This case must be discussed in our multidisciplinary team meeting. That is the ultimate safety net. It proves you're not a lone wolf. You work as part of a team to make complex cancer decisions. So you see, the Viva is so much more than just an exam. It's really a simulation of your future life as a consultant. It's testing your knowledge, sure, but also your judgment and your ability to stay cool under fire. So as we finish up, the final question is for you. Looking at this whole framework, what's the one area in your own structured approach that you know you need to strengthen the most?